Hello friends, welcome to the channel Dewdear Academy. In this video, I am discussing the multiple choice questions MCQ discussion, and this video will be useful for all competitive nursing exam preparation. For all the exam preparation, this video will be useful, and the upcoming exams are ESIC exam, then DSSB nursing tutor. So for all these exams, the discussion of these multiple choice questions will be useful, and I have selected the subject psychiatric nursing. I have selected the subject psychiatric nursing. So here the question is, delusion is a disorder of. Delusion is a disorder of thinking, memory, intellect, perception. Delusion is a disorder of thinking, memory, intellect and perception. So we should know that delusion, it is a disorder, it's a thought disorder. Okay, so here the answer is thinking. Answer is option A, thinking. That is the answer. So delusion is a thought disorder. Okay, delusion. First, what is delusion? It is a false, unshakable belief or false fixed belief. Okay, false, unshakable belief is known as delusion, and it is a thought disorder. So I told you this is a disorder of thought or thought disorder or thinking disorder. Okay, disorder of thinking. So here we should know there are different types of thought disorders that can be in the form of stream of thought, then content of thought, then there is thought disorder which is in the form of thought, and also the possession of thought. So these are all different types of thought disorders in the possession of thought. So among all these thought disorders, delusion is a disorder of content of thought. Delusion is a disorder of content of thought. So from this question, we come to know other important points. First one, the definition of delusion. What is delusion? It is a false, unshakable belief. That is the first point. Or false, fixed belief or persistent belief in something which is not a fact. Persistent belief in something which is not a fact. That is delusion. And it is a disorder of thought. Delusion is a disorder of thought. So again, one more question you can expect, that is delusion is one type of thought disorder. It is a disorder which is in the form of content of thought. Okay, there are many disorders which is coming in the form of thought, in the possession of thought, in the stream of thought and all, but delusion is a disorder of thought content. Okay, and also there are different types of delusions, like delusion of persecution, delusion of grandeur, delusion of delusional jealousy, then delusion of reference, somatic delusion, desire delusion. These are all different types of delusion. So this is the answer of this question. It is a disorder of thought. Then the next question, a state of diminished consciousness in which the patient remains mute and still with the eyes open. A state of diminished consciousness in which the patient remains mute and still with the eyes open. Options are catatonia, stupor, panic and hysteria. So from this question, it is clear that this is a disorder of consciousness, because the question is, it is a state of diminished consciousness. Okay, so this question is based on the disorders of consciousness in which the patient remains mute and still with the eyes open. So we know catatonia. What is catatonia? Catatonia is a state of unresponsiveness to external stimuli. Unresponsiveness to external stimuli, or it is the inability to move normally in a person who is awake. Catatonia include the mutism, negativism. So catatonia is a state of unresponsiveness to external stimuli. So this is not the answer. Then stupor. What is stupor? Stupor means it is a condition in which the patient remains immobile, mute and unresponsive but look fully conscious. The patient look conscious but the patient remains immobile, mute and unresponsive. Okay, patient remains mute and still with the eyes open, means we look like conscious but there is diminished consciousness and patient remains mute, that is stupor. So here the question is the patient remains mute and still with eyes open, that is stupor. So here the answer is option B, stupor. Then what is panic? Panic attack or panic anxiety attack. It is a sudden unreasonable feeling of fear that is coming in the anxiety. It is a sudden unreasonable feeling of fear, that is known as the anxiety, or repeated episodes of sudden feeling of intense anxiety and fear. Then hysteria is a type of conversion disorder. So here the answer is stupor. Stupor is the answer. So panic attack is not and hysteria is not the answer. Stupor means it is a condition in which the patient remains immobile, mute and unresponsive but look fully conscious. Auditory hallucinations are not seen in options: schizophrenia, mania, hysteria, amphetamine toxicity. Auditory hallucinations are not seen in. So here we have already discussed the auditory hallucination, and it is mainly found, auditory hallucination is mainly found in case of schizophrenia, then in case of mania, amphetamine toxicity, alcohol withdrawal and all. We know hysteria actually it is a neurosis. For neurosis, we can say that in case of neurosis, hallucinations may not be present. For psychosis, the hallucinations are present, but for neurosis, hallucination is not present. And so here, hysteria is the answer. Option C, hysteria is the answer. Hysteria, it is formerly, the conversion disorder was formerly called as the hysteria. It is a type of mental disorder in which variety of sensory, motor and psychic disturbances are occurring in patients. So it is a conversion disorder. And hysteria is an example of neurosis. Hysteria is an example of neurosis. So again, one more difference between this neurosis and psychosis is that for neurosis, hallucinations are absent, and for psychosis, hallucinations are present. Hallucinations are absent in in neurosis. So here, from this, auditory hallucinations are not seen in. You can find out the answer. Option C. Option C is the answer. Answer is option C. Okay, the next question. Confabulation is a disorder of. Confabulation is a disorder of perception, thought, memory, mood. So there are different types of disorders, like disorders of perception, then disorder of thought, disorder of memory, disorder of mood. We know this in this disorder of perception. The perceptual disorders mainly include this hallucination, illusion, all these are coming in the disorder of perception. Hallucination, illusion are examples of disorders of perception. Then disorders of thought. Disorders of thought or disorders of thought and speech include the word salad, echolalia, perseveration, barbituration, all these are the disorders of thought. That means disorders of thought can be in the form of thought, the stream of thought. Then disorder of memory. Disorder of memory include hyperamnesia, amnesia, paraamnesia, confabulation. All these are coming under the disorder of memory. All these are coming under the disorder of memory. So confabulation. Confabulation means creating the imaginary events to fill up the memory gap. Creating the imaginary events to fill up the memory gap. That means the gaps in recall are filled by fabrication, which is mainly found in alcoholic patients and all. Filling the memory gap by imagination. In simple way we can say it is the filling of the memory gap by imagination. That is confabulation. Okay, filling memory gap by imagination is known as confabulation. Filling memory gap by imagination. So in this question, confabulation is a disorder of memory. We know mood disorders. Mood disorders include this mania, depression and all. So this is not the answer. And confabulation is a disorder of memory. So this is the right answer. It is a disorder of memory. So there are many terminologies. There are a lot of terminologies that should be understood in psychiatric nursing. So I hope this video will be useful for you. Okay, the next question. Clouding of consciousness is a feature of selective amnesia, dementia, delirium, Alzheimer's disease. Clouding of consciousness. So clouding of consciousness means, actually this is coming under the disorder of consciousness. Disorder of consciousness. Disorder of consciousness include the different disorders like clouding of consciousness, then stupor, confusion, drowsiness, coma. All these are included in the disorders of consciousness. So clouding of consciousness means it is a diminution of alertness. The consciousness become cloudy at some time, or difficulty in paying attention. That is clouding of consciousness. And it is also known as brain fog. So this is mainly an important feature in delirium. Clouding of consciousness is an important feature of delirium. So in this question, clouding of consciousness is a feature of selective amnesia, dementia, delirium, Alzheimer's disease. Here answer C is the correct answer. Answer is option C, delirium. So thank you for watching this video.